Okay, we're about to jump into our next segment. This is the place where we talk about what's happening in the world with respect to COVID-19. Updates is up next. Don't go anywhere.
COVID-19 Diaries.
COVID-19 Diaries.
COVID-19 Diary.
Today is the 18th of January 2021. The world has recorded a total number of 95,531,665 coronavirus cases. 68,248,801 people have recovered. Now, well, the death toll has crossed the 2 million mark. Yeah, that's the news at the moment. So 2 million people, 40,851 have died. Unfortunately, condolences to all bereaved families out there. And to all gone souls, I say rest in peace. For those of us still out there, let's please continue to adhere to safety protocols, all right? Let's now get here the updates of COVID-19 from Africa. Stay with us, don't go anywhere.
COVID-19 Africa. COVID-19 Africa. Daily updates.
Today, January 18th, 2021, Africa has recorded 3,278,308 COVID-19 cases. 2,688,884 have recovered from the virus in Africa. 79,011 have passed on due to COVID-19. Again, condolences. Let's continue to adhere to safety protocols. Now, coming back to our base, Ghana, it's not looking pretty as numbers keeps going up. Yesterday, the president gave addressed the nation. That's the 22nd one he did, and he was. I mean, there's a lot that he talked about, but then, I mean, as Epi mentioned on trends on social media, she was talking about the fact that there were a lot of things. There's this particular thing that he didn't mention, and people were like, I mean, this should have been mentioned. How did this actually miss out, in the speech that he gave? Because during the election period, the rallies, the gatherings and everything, definitely this outcome should be expected, right? So, I mean, it's not looking good as the numbers are going up drastically. I mean, 900 just a week ago. I mean, we're looking at the cases have risen from like 900 active cases to 1,924. On a daily basis, 200 people averagely get infected, and that is not looking pretty. Now, the centers where these cases are being held talk about those infected. A week ago, it was just 18 people in critical condition. Right about now, we have about 120 people in critical condition. That's like times 5, double the number. What the hell is going on? And at the moment in our base, Ghana, he has actually talked about the fact that there's going to be a strict adherence to safety protocols. And that means that the police force would ensure that everyone out there uses the mask. But my question is, isn't this a late call? I don't know about you guys, but let me invite my colleagues to help me out. Let me begin with Epi. Isn't this actually a late call to allowing the police take charge of, the adherence to safety measures? I mean, this should have been like the first thing right from the onset. I don't know about you, but I feel this is like too late. But then again, there can be some reforms along the way. Epi?
Yeah, I think late or not, I think it's better than never. In
Okay.
other case, I mean, cases are rising. They could go down again if we're able to contain the issue.
Right.
But it would be better than not letting anybody do anything at all. Because if the cases triple or quadruple in number, we'll be in trouble.
Mommy, today is school reopening day for all levels. Today, when I was on my way coming around the UPS, you should see the queue outside. It was so long, and guess what? They were actually queuing to ensure that everybody gets checked using the what do you call it? The what do you call that gun again? is it the temperature gun or something? It was like a long queue, very, very long. And I'm like, okay, that's one aspect of the whole conversation. But what are we looking at? Are we going? Is there a possibility that there could be a lockdown? Because the president has made that very clear. Don't give me a reason to go back to lockdown.
He said we shouldn't give him a reason to go back to lockdown.
Yeah.
I mean, the reasons are staring at us. The reasons have been there,
Mm.
glaring at us in our faces
Right.
since like December,
Mm.
even before December.
Mm.
But like Epi said, it's better late than never.
Mm-hmm.
I mean, this whole police checking thing
Right.
should have started a long time ago.
Absolutely. Right from day one. Right from day one.
And even though he has said it,
Mm.
I mean, I came to work this morning.
Mm-hmm.
I passed by places where there were policemen standing.
Mm.
There were people walking with no nose masks, and
So I don't know if.
so I don't know.
Yeah.
Maybe they are not tasked with doing that, but I mean, let's just hope once he said it,
Mm.
it will be the measures will actually be put in place.
Okay.
And then everybody will act on it.
Right.
Because with what I saw today, like my mom, I wasn't in the house when the address was happening.
Okay.
Actually.
Okay.
But my mom watched. So I came back and then I asked her what the president. She was like, oh, this. And she actually gave us a warning.
That you don't go out without a mask.
She said, so I asked her, so is it that once they catch you not wearing a mask, you're
Okay.
going to be fined or you're going to be jailed?
Mm.
And then she was like, if we want to know what will actually happen, we should go out without nose mask
And see
see.
for yourself, eh? You get that. Then again, the new variant has been discovered in Ghana. Another one again.
This is, I mean, it already was scary. It has become scarier.
Absolutely. Absolutely.
So I feel like all of these measures that the president talked about
Mhm.
should actually be put in place and then worked on.
Yeah.
Like, really, really worked on.
Mm.
Because, I mean, if we're recording 200 cases a day,
Yeah, it's no joke, huh?
and people in critical
Imagine.
condition numbers are
Imagine.
rising, then it means like it
Imagine.
has gotten
Imagine.
out of hand already.
And the Ghana Medical Association are also proposing that the testing should be made free. I mean, that has always been my concern.
Yeah, the
That
testing
has
is-
always been my
I
concern
mean-
because should we have the vaccine today, you just cannot go and take it. You need to know your status, right? Hence
Yeah.
test. So how is that going to be? Well, till then, let's wait and see. But at the moment, I think it should be subsidized.
And I think
Possibly
it's because
free.
of the price. That's why most people don't go to check.
Exactly.
Because the only time you are checked for free is if the ambulance comes to get you. It's like
yeah, that's a
if you're
contract
s-
tracing
yes,
thing. Yeah,
and then-
yeah.
But if maybe you're in the house,
Uh-huh.
I'm feeling feverish, I have
Yeah.
a runny nose, I don't know where it's coming from, I
Yeah.
can't breathe. I cannot just walk into a hospital and say I want to get tested for COVID.
When you need 400 cedis, that's like $68 approximately
to just
check.
And then once you check, 14 days later, you have to go check again.
Really?
Yes.
I didn't see that coming.
Okay. If you check and it's not positive,
Okay.
and you're showing like let's say 1 or 2 symptoms,
All
you
right.
have to wait for 14 days and then you check again. Even if you check initially and it's positive, and
Uh-huh.
let's say you're treated, let's say you're hospitalized, after some time
Yeah.
you still have to check again to see if it's still there.
Well, thank you.
Because I have a friend whose father contracted it,
Right.
and he lives in the house with his father, his
Okay.
stepmom, his
Right.
like 3 or 4 siblings.
Mm-hmm.
So once his father contracted the virus, all
Mhm.
of them had to get checked.
Wow. You need about thousands of CDs to do that.
So
Okay.
yeah, the testing has to be made
To
free.
made free.
Or maybe
At a lower cost.
affordable.
Anyway, let's see how it would, pan out in the coming days. Thank you very much, guys, for joining me. The show was Africa Daily on Africa Global Radio. Generally, in a nutshell, please be safe out there. Don't wait for someone to wear the mask before you think of wearing. No, wear it. It doesn't matter where you are.